Thank you, Madam President. I rise today to discuss Senate Resolution 272, which is recognizing April as Sexual Assault Awareness Month here in the Commonwealth. For 25 years, Sexual Assault Awareness Month has united survivors, advocates, and communities in the shared commitment to end sexual assault, abuse, and harassment. Madam President, this resolution is more than marking a month on the calendar. It is about acknowledging survivors, confronting uncomfortable truths, and recommitting ourselves to prevention, justice, and healing. Sexual assault affects people of every age, gender, race, and community. It happens in cities, in suburbs, and rural towns. It happens in schools, workplaces, homes, nursing homes, and too often it happens in silence. According to RAINN, the nation's largest anti-sexual violence organization, nearly every minute in the United States, someone is sexually assaulted. Every 9 minutes, that someone is a child. And despite the harm that they cause, the vast majority of perpetrators, nearly 98% of them, are never held fully accountable through the criminal justice system. RAINN estimates that for every 1,000 sexual assaults, 50 reports lead to arrest, 28 cases lead to felony convictions, and only 25 perpetrators are sentenced to incarceration. And we know these numbers do not tell the whole story because sexual assault remains one of the most underreported crimes. Many survivors never come forward due to fear, shame, trauma, or concern that they will not be believed. This is, quite frankly, both terrifying and unacceptable. And as a survivor of sexual assault, I understand that pain, that grief, that trauma, and the challenges faced by our survivor community. And today, while we acknowledge the reality of this violence, we must also recognize something equally powerful: the extraordinary strength and resilience of survivors. Survivors are not defined by what happened to them. They're defined by the lives they continue to build, the courage they display on a daily basis, and the communities they continue to strengthen. And that is why it is so important that we do more to help survivors of sexual assault, and that could start with adequately funding our 57 rape crisis centers here in our Commonwealth during this year's budget. Flat funding is a cut when more survivors are reaching out for help every year, and state resources have not kept pace with reality our support groups are facing on the ground. The $12.5 million increase in this year's state budget that the Pennsylvania Coalition to Advance Respect is advocating for will not only sustain essential services for survivors, but it will expand prevention services, workforce stability, and public safety infrastructure across our Commonwealth. Funding to support organizations that assist survivors of sexual assault providers should not be a partisan issue, and I know that some of you on the other side of the aisle have been really great to work with on this issue, but I hope that this is the year that we push hard together to get this done. As we know, this is a human issue, and we all represent people that have suffered from these horrible incidences. There's so much more that we can do, and we should collectively believe in our survivor community and show them by funding these programs. It is also important to highlight the issues plaguing our service members who experience military sexual trauma. National data from the VA's National Screening Program reveals that about 1 in 3 women and 1 in 50 men respond yes, that they have experienced MST when screened by their VA provider. Although rates of MST may seem higher among women, that's because there are more men than women in the military, and there are significant numbers of women and men seen in every VA who have experienced military sexual trauma. RAINN estimates that there are 18,900 members of the military who experience unwanted sexual contact annually. That's every year. For those who choose to report the assault, it can be a very difficult and isolating path to walk, often alone or with very little support. The psychological impact of the assault and resulting trauma can push survivors out of service and lead to tremendous difficulty readjusting to their civilian lives. Senator Lindsey Williams and I have worked to recognize this group of survivors over the past several sessions through resolution and a Senate bill. And it is my hope that we can finally pass legislation to a bare minimum, raise awareness and support these survivors that have also served our country. Madam President, I am proud to work alongside my legislative colleagues who signed on to this resolution and all of the amazing advocates across the state in the fight against sexual assault and violence. We must continue to support rape crisis centers, counselors, victim advocates, law enforcement professionals, healthcare providers, and educators who work every day to help survivors rebuild their lives. And to the survivors across our Commonwealth, and to all of the victims of sexual assault and violence, I hear you, I see you, and I will fight for you. Thank you, Madam President.